Okay, 212.
Hey.
I was hoping somebody was going to show up.
We got the right room, right?
Hold on, we're recording. Hold on.
Test fees. Okay, so for recording, and I'm going to get the. Okay, there you are. So, okay.
Okay. So it is my privilege to introduce Dr. Al Lowenfels, who has been with, how long have you been with NYMC? We're not going to say how long he's been, but he is faculty emeritus in the Department of Medicine, in the Department of Surgery, and is now a professor of community and preventive medicine. When I looked up, I knew you were a prolific researcher, but I didn't quite know how prolific. So I looked it up and I saw that there were 252 articles. I don't know if that's the right number, but it was a number that was so big that it was a very impressive number with over 15,000 citations. And you've recently turned on a broad variety of topics. Really a very broad variety of topics ranging from surgery to cancer to I saw one on alcohol abuse, and now we're going to learn about something that is really a hot topic for today because of all of the discussions of vaping and its water pipe tobacco smoking. Thank you. Let's give a warm welcome to Dr. Lowenfels.
So Adam, thanks very much for the kind introduction. There's an old saying, it could never be a prophet in your own backyard. And I think it's true because I've talked on every continent. This is the first time I've just walked out of my office and came around the corner. So I was very happy about that. So we're going to be talking about a different type of tobacco exposure, and it's water pipe smoking. Now, has anybody in the audience smoked water pipes? Nobody at all. Okay. So this will be. This will be.
Maybe once or twice.
You've tried it once or twice.
Maybe once or twice.
Okay. So if there are any hard questions, Adam, I'm going to refer them to you. Okay.
So this is a hookah, right?
Yep. Hookah.
A hookah. Yes.
Yep. So all right. So essentially, it's a new topic. Let's see where it wants to go. No. Okay, we'll use the old-fashioned way. That's good. And so it's not the way it used to be, but when you're old and gray, that's what happens. Does this work?
I don't.
Let's just turn it on. I don't want. I can talk.
Right here.
Okay, let me try that. Where's the remote here? Oh, let me just make sure that this is so finicky. Okay.
Okay, I prefer this anyway.
Okay. Okay. Good.
Wonderful. Okay, can we hear? Everybody can hear. Okay, good. So here are some of the synonyms. So it's hookah or hubble bubble, nargila. There are various different synonyms. Shisha is another one. So we'll use them interchangeably.
We're going to do sit next on the very top there.
So let's see. This is.
I'm guessing you could probably just.
Okay.
Yeah, just use the keypad down.
Yeah. Okay. So the story goes back really to 1492. Everybody knows the tobacco story started with Columbus, and he brought tobacco from the Caribbean area back to Europe, and it spread throughout the world. And there's some debate, some question whether he also brought syphilis back. I think he probably did. But that was 1492. And between 1492, cigarettes did not come along until about 400 years later. And in the interim, there were a lot of other ways of tobacco ingestion exposure. So this is kind of the history of tobacco. Let's see. Okay, here we go. Nothing is working very well today.
Should be able to just hit the arrows.
Yeah, I would just use the arrow key there.
Yep, let's use this little pointer here. Okay, let's go back. Okay, all right, maybe this is working. Nope, nothing is working smoothly today.
Okay, got it.
Okay. Anyway, there's a long gap, 400 years, and so people smoke various different ways for tobacco. This is very popular. This is a lovely Dutch painting. Tobacco exposure was largely by pipes for really a long, long period of time. But in parts of the world, another form was hookah or water pipe. And it is, as you see, quite entirely different. And I call your attention to right up here at the top, there's a lump of charcoal or coal that is what heats up the tobacco. So there's tobacco underneath that, and then the person has a mouthpiece which sucks on and brings the tobacco smoke down into a container of water, and then smoke goes back up after it's been filtered through this water and enters a person's respiratory system. So it's quite different from cigarette exposure. And some of them can be very elaborate, very artistic. And this habit seemed to have originated in the Middle East and India and in China. And from there, it's gradually spread to the rest of the world. Here is a hookah lounge in the Middle East. It happens to be in the country of Qatar, and it's at the Ritz-Carlton. You can see it's overlooking the Persian Gulf. It's very elaborate. There would be an attendant that would come along and fix up your pipe for you, light the charcoal, get everything adjusted, and then you would sit in rather luxurious circumstances and enjoy your water pipe. Quite different from cigarette smoking. This is, I believe, in Israel. I think that's the Dome of the Mount back here. Not sure, but it's definitely in Israel. Again, you see, it's more of a social experience. A couple of water pipes, and people are just sitting out enjoying it. It's a social experience. And here's one. Just came in at the critical moment. Here's one in, I think in the USA, and I'm not exactly sure what's going on. It seems to be some sort of a party. There
Oh, yes.
2 or 3 lucky men. That's about all I see there. The rest are all women. I really don't know why, but it again emphasizes that it's a social experience. And you don't have to go to the Middle East to enjoy hookah smoking. Here's a shop right in White Plains. You can see there's all kinds of equipment. Here's some mouthpieces. Here's over here some actual equipment. So it's spread rapidly to the USA. And we'll discuss some of the reasons why that should be. And any tobacco talk has to include Sir Richard Dahl. He's my personal hero because He worked effectively up until he was 92 years old, and he's been my role model, my goal, ever since learning about him. And he really was a pioneer for tobacco research. Here was his original paper. Goes back to 1950. He followed these patients for another 40 or 50 years. Latest report came out in the British Medical Journal almost 50 years after this first report. Very, very strong study. Every study on smoking has found exactly the same thing as a high risk, 10 to 15-fold risk of lung cancer. And it was a cohort study. Unfortunately, for hookah, for water pipes, we do not have long follow-up studies. We do not have cohort studies. With one exception, most of the studies have been case control studies. They're not nearly as strong. So we're going to go ahead and show you what evidence is available, but it's nothing like what the evidence is for cigarettes. So this is from the New York State Department of Health, and it looks like overall hookah smoking in New York State is about the same as in the rest of the USA. It's about 4%, which doesn't sound like a very big problem. But what does that mean? Is that an accurate looking statistics? Let's look a little bit more. So here's overall smoking prevalence in New York. It's way down. But if you divide those two numbers, the real story is that 28% of smokers are smoking water pipes or hookah. So it gives me a good chance to mention this little book by Darrell Huff, which is still available. We have a copy in our library, How to Lie With. Has anybody read this little book? It's worth taking a look at, because if you go backwards, and let's see what happens, this number doesn't look very bad, does it? But I think the problem is that they've used the wrong denominator. This is from the whole USA, or the whole New York State population. And really what you're interested in is the proportion of smokers that are smoking hookah. So one easy way to lie with statistics is to just switch the denominators, right? And a lot of epidemiology is just looking around for a good denominator. Okay. And the best thing about this little book is are the illustrations. It's worth reading the book just for the illustrations. Okay, so how frequent is water pipe smoking? It's about as frequent as cigarette smoking. In the Netherlands, about a quarter of the population have smoked a water pipe at least once. We have one member of our audience that smoked it at least once, right? So that's 15% of the population in here, okay? And in Iran, the Middle East, where it's much more prevalent, it's about 20%, almost equal to cigarette smoking. So it's a rising, increasing trend. Okay, so this looks at time trends, and unfortunately, as you can see from this rather messy looking data, it's not very easy to tell what's going on, except I'm pretty sure it's increasing. This graph is really hard for me, mainly because I'm colorblind and I can't see all the colors on here. And I'd just like to caution everybody, when you make your slides, 6% of your audience is going to be colorblind. You want to be very thoughtful about that. Okay, another way of looking at time trends is just look at what the search story has been. So this is from internet searches, and it looks at, everything's working now. Oh, okay, so here we're looking at water pipe and electronic cigarettes. And you can see that over time, there's been a really big increase. And I did a similar search on Medline. Medline has a good search for, there's a nice little chart that comes up with every Medline search. I don't know if you've noticed it. It's on the right hand, kind of lower down. There's a nice little box. You can look it up. And this shows from 2000 to 2019, there's really been a steady increase in the number of searches on Medline for water pipe. And water pipe is a search term now in Medline. So this is again from the New York State Department of Health. About the same in the USA as in New York State. They're younger people. They're mostly males. It's more frequent Hispanics, African Americans. I didn't realize that. They have higher levels of education, moderately high income, and they have somewhat different gender orientations.
That's a quick question about.
Yeah.
Previous, how does that compare to tobacco smoking? Like the red?
Yeah, I think this is a little bit different. I think this is a little bit different. I don't think you find tobacco smoking, I think now it's mostly lower middle income. Smart people are smoking as much. They were the first to do that. It came in from the top, worked its way down. Now it's down at the bottom, and the top is stuck. So it's sort of an up and down. Okay, this looks at hookah lounges and their relationship to colleges. A lot of college kids are smoking. And this chart shows the location of hookah shops in relation to colleges. And they're very close, very close. The dark circles are the ones that are the closest to colleges, within a few kilometers, right? Within a couple of miles. So the big tobacco is smart. They know who are the customers and they make the temptation as close as possible. So one of the things we did was to do a meta-analysis looking at whatever evidence we have on hookah smoking and cancer, which is an area that I'm interested in. This is a publication. And the et al., I'm one of the et als, and it just matches up. But anyway, that's what I am, an et al. And if you do a meta-analysis, you have to put one of these little charts and graphs, how many articles you looked up and why you excluded them and all of that. Has anybody done a meta-analysis? Anybody? I have to say, I'm not a big fan of it. I really don't like it. I think one big cohort study, one big randomized control, I'd really rather bet the store on that. I'm not that enthusiastic about it. But it's a big industry. Okay, so we wanted to look at the link between water pipe smoking and cancer. So it's just cancer. It's not respiratory. It's just cancer. And they were mostly in the Middle East and in Asia. And when you do a meta-analysis, you're supposed to do something about the quality of the studies. So we divided the group into high quality and lower qualities. And these data are just on the high quality studies. And we found an excess risk of head and neck cancers, the mouth particularly, throat, esophageal cancer, and lung cancer. Well, that's predictable. This is where the smoke would come in contact with the body. And this is a little bit more details. So what this is telling us is that there's about a twofold risk, maybe a little bit more for head and neck for people that smoke water pipes compared to non-smokers. And I-square shows that for most of the sites, there was really no difference. They were all homogeneous. Okay, and there have been 2 or 3 other meta-analyses came out about the same time. They all showed almost identical findings. So as far as cancer is concerned, this new form of tobacco exposure is serious. I found one cohort study that came out since then, and it was conducted in Iran. It was greater than 50,000 smokers, so it's a big study, but only a very small fraction were water pipe smokers. Follow-up was about 8.5 years. It was sponsored by the International Agency for Research on Cancer. So it's a good study. And in the highest group of water pipe smokers, it was about a 2 to 3-fold increased risk of cancer. So again, this is confirmatory, but it's only one cohort study and in one country. Let's get, that's good. So what's the difference between tobacco exposure in water pipe smokers and cigarette smokers? So if you smoke a cigarette, you inhale about 5 to 6 liters of smoke per cigarette. You take a few puffs, you put the cigarette down or hold on to it, take a few more puffs, and the total amount is about 1/2 liter. Water pipe smokers inhale a huge amount of smoke. We're talking about 7.5 to 200 liters of smoke, because it takes about an hour to smoke a water pipe, and you take many puffs, and because it's cooler, you can inhale more deeply. It's less irritating. That's because the water filters out some of the harshness, and it cools the tobacco down so you can take a deeper breath. So a single water pipe exposure is about 100 times the amount of smoke that you get from a cigarette. So that gives you a ratio of about 10 to 1. So it should have a higher risk of disease. And that's, I think, one of the research questions. Now, another risk is carbon monoxide poisoning. Has anybody taken care of or knows anything about carbon monoxide poisoning? Carbon monoxide is a deadly killer. How many people have a carbon monoxide exposure in their homes? Just about. Okay, so you know it's a really big, insidious danger. It's a hazard for water pipe smokers. And it can happen even if you're not inhaling and using the water pipe, if you're just accompanying a friend and sitting in a cafe. In the USA, many of them are special lounges that are just for water pipes or cigars. And the chemistry is that carbon dioxide can combine with carbon. And you remember the picture I showed you, there's a lump of coal up on the top of the apparatus. So you're inhaling carbon monoxide, you're inhaling fumes from carbon, and that combines with carbon dioxide to produce 2 molecules of carbon monoxide. And if it's recognized in time, you can wash out the carbon monoxide with oxygen, with about an 8-hour treatment. So this is a report looking at 5 or 6 different hookah lounges. And what we're looking at is the amount of carbon monoxide in each of these different lounges. And I've drawn a line here that indicates the safe level for carbon monoxide for an 8-hour period. And it shows that most of the lounges were below the OSHA levels, except for this one lounge, where on different time periods, some of the carbon monoxide levels were above the recommended levels. So just by sitting in a shisha lounge, you could be exposed to carbon monoxide. Now, the other thing that you're exposed to is small particles, particulate matter. Has anybody worked with PM 2.5, a little level? You have, okay. That's the correct level that they say is 2.5. Okay, and the EPA standard levels are 50, what is this, 50 parts in exposure within a 24-hour period. Can you define that a little bit more carefully, what that is exactly?
So I would think Dr. Kim would be the better person to.
Yeah, because I'm not
address
exactly,
that,
what are
'cause
they talking about?
I've dealt with it in terms of asthma.
Yeah. What are
What
they talking about? If you're breathing in air that it's, how many parts per 1,000 or million? What are we talking about?
parts?
Parts per million.
Parts per million, yeah.
Parts per million.
Yeah, okay.
Million parts per million.
Parts per million, okay. All right, so we're talking about exposure to more than 2.5 parts per million is above the standards. Yes. So that apparently occurs in some of these shisha lounges. You can see all up here, the levels are higher than considered safe. You can also see that there's a strong correlation between carbon monoxide and small particles. Well, that's understandable. So why is water pipe smoking popular? One thing has to do with the introduction of flavored products. The original product, smoked for hundreds of years, was pretty rough, irritating, and the big tobaccos come out with much more sophisticated, refined products that are flavored, just as with the electronic cigarettes, where there's flavoring added, and that's appealed to younger people. The environment is, I showed you 2 or 3 examples of attractive environments. It's a social media. It's something you can get together with your friends and enjoy. We have no tobacco control policies specifically designed for water pipes. We have things for cigarettes, but we have nothing really for water pipes. Then a big issue is that the consumers believe that the product is safe because the tobacco fumes are filtered through water and they think that sucks out all the bad stuff. That's wrong. And the final reason is that smoking cigarettes is expensive. I mean, it's not the sort of thing you wouldn't want to give somebody asks you for a cigarette. That's, what are we talking about? 50 cents or $1? It's expensive. Whereas tobacco for use in your water pipe comes in a big package and it's relatively inexpensive. So I think that's another final factor. So does water pipe smoking lead to cigarette smoking? Again, similar to the electronic cigarette story, big tobacco is interested in electronic tobacco delivery devices because they know that it will increase eventually cigarette consumption. And exactly the same thing seems to be true with cigarettes, with water pipe smoking. So this is a pretty big systematic review. And if you started with a water pipe, it about doubles or triples your likelihood of coming down, eventually switching over to cigarettes. And these are some of the attitudes investigators have put together with regard to hookah smoking. It's socializing, it's relaxing, it's entertaining, it's something you would do different than cigarette smoking, which is something you do when maybe you're a little nervous or you're thinking about something else. This is you actually have to sit down and be willing to spend an hour. That's about what it takes to smoke one pipe. And they believe it's not harmful and it's not addictive and that they can stop anytime they want, which is not true. And they were really confident about their ability to stop smoking. So I'd just like to put together a few conclusions of it's dangerous. It has a unique toxicologic profile that includes carbon monoxide, which is not a big problem with cigarettes. I don't ever hear of anybody coming down with carbon monoxide poisoning from cigarettes. It's not a safe alternative to cigarettes. And the myth that running the smoke through water purifies it is not true. And the charcoal part is an additional hazard. I mean, you wouldn't want to sit over a barbecue and just inhale the fumes, but that's essentially what you're doing. Then there's the shared risk and the transmission of infections, because oftentimes one water pipe will be shared by 2 or 3 or more people using the same head to inhale the smoke. So there's a risk of infectious disease, HIV, tuberculosis, whatever. And the other problem that we have is that the newer flavoring agents make things much more attractive. Here are some continuing research issues that I see. I really don't understand why the risk, at least of cancer, is so much lower than for smoking cigarettes. And my only thought is that if you're a cigarette smoker, you're going to smoke probably 20 cigarettes a day, day in, day out. Whereas water pipe, you might smoke a pipe maybe once or twice a week, not as frequently. So that is maybe exposure is less, but I'm not sure about that. And as I said, we have no good studies like the Richard Dahl story where you could measure pack years. We know what a pack year is. It's smoking a pack of cigarette every day for a year. I don't think we have good data like that for water pipes. Second big issue is how do we convince the public about this? It's public education. That's something your department will be working on. It's a really big hazard, but how do we transmit that scientific knowledge to the general public? And how do we come up with effective legislation? So those are the research issues that, as I see them. And here are 3 really good references. The WHO advisory note is short but sweet. It goes over all the issues, the background. It has hundreds of references if you're interested in anything else. It came out in 2015, but I don't think it's changed much since then. Then the article by Maziak, that's been widely referred to He's really the expert on water pipes. And the third one is some methodology of how they measure the toxins coming out of a water pipe. So that's about it. If there are any questions, simple ones, if they're hard ones, I'm going to refer them to Adam. So any questions?
This was really good. Vaping is big news now.
Yeah.
How is it similar? How is it different based on what you understand with that?
Okay, now there are vaping water pipes. They're not the same because they have electronic heater. They do not have charcoal, so they're
And on the carbon monoxide issue.
they don't have the carbon monoxide issue, they don't have the toxins that would be associated with carbon, with burning carbon. I think some of the issues are similar. I think the issue that vaping is safe, at least for this year, that issue, everybody thought, well, it's an electronic cigarette, we're not smoking the same way. That issue is the same as you have. So there's a lot of similarities, but there are some differences. And I think everybody's up on the latest report of the contaminant in the cartridges that caused the deaths.
That's the lung damage, yeah.
That was a wonderful epidemiologist that picked that up fairly quickly. Okay, yeah.
Thank you very much, the summary of the fight.
Thank you for coming.
I'm environmental point of view. What is your position, right? And what do you think about this? Is you mentioned about two risks: carbon monoxide and PM 2.5 kind of nanoparticle.
Yeah.
And what do you think about which of more the some dangerous risk causing to health? For example, you mentioned some risk. One of the risks is cancer.
Yeah.
But you did not show some comparison between some water pipe smoking versus e-cigarette or some regular cigarette. How much you mentioned 3 times of the cancer?
Yeah.
Is it really low?
Okay, so I think I'm going to repeat the question while I'm
Okay.
trying to think of an answer, which is always.
Good. Experienced presenter.
It's always a good strategy.
Yeah, I'm just worried about this carbon monoxide very toxic. If you mentioned, why you do not think about you are surgery and you are patient, but there is no toxic urine damage, kind of the blood
Yeah,
clotting.
there certainly could be neurotoxicity.
Yeah.
That is a real problem. When we talk about carbon monoxide, we usually think of acute toxicity.
Yeah.
But there certainly could be chronic exposure.
Yeah. This is good.
How would you go about investigating?
No, I have no funding about this, but I'm
I'm just trying to, how would you set up? Well, I think what you could do is you could take water pipe smokers and you have to do repetitive studies and you have to look at, you have to do some kind of measure of brain damage over time and see what happens.
If you think about some kind of carbon monoxide is really hazardous in the 1 5 days,
Yeah.
looks like this is more called the blood.
Yeah.
Kind of.
But blood that goes right through into the brain, is sure, because one slide I did not show was a woman just sitting, not even smoking. She was sitting with her companion in a water pipe lounge. She passed out. She was unconscious, taken to the hospital. She had very high levels of carboxyhemoglobin.
Yeah, that's right.
And it took several hours for her to get the levels back down. So repeated exposure like that, I could see would lead to long-term diminution. Good reason not to smoke for it. But that's looks like you have.
Well, I'm just curious why there isn't legislation that for such a thing.
Well, look how long it took for smoking damage to result in legislation. We knew in 1950, I showed you there, 1950 we knew it was a problem. And when did we start getting legislation? Really around what, 1990, it was about 30 or 40 years. So there's always a gap between scientific knowledge and implementation of exception.
Big business.
Yeah, people want to make money.
All about money.
Yeah, it's about money, but that's why you've got a school of public health to fix that up. That's your job.
We don't want that money. When I lived in Illinois, the state was going through no smoking in restaurants and that type of discussion. And of course, everyone wants an exemption, the casinos wanted an exception, the bars wanted exceptions and all this stuff. And they just said, no one. The only exceptions they gave were the hookah bar or the water pipe places. But even then, they were hesitant because of the people working there, that they have all this exposure, and people say, well, if they don't want to work there, then get another job. Easier said than done.
That's why I show some of these levels, because long-term exposure, and the employees are the ones that are really at risk. You wouldn't want that job.
Now, most of at least the hookah jobs in Illinois were family owned. So, if me and my wife want to work there, and we know we're going to get exposed, that's different. But we're not necessarily hiring a bunch of people to come on in. So.
I think the other thing that's worrisome is that the trend is going up. And cigarettes are known to be dangerous now. Everybody knows that, but nobody knows that this. So we have a job to do to get the message out. A good place to stop.
Anybody has a question?
I did, but it's okay.
Somebody have a question over here? No?
May I contribute to this talk?
Yeah.
So I have done some research on both vaping and smoke. And what I have found is that, yes, monoxide is a problem. But the smoke also produces formaldehyde.
Oh, yeah, there's all kinds of stuff.
And the biggest concern that I saw in that chromatogram was the level of benzene. It has enormous amount of benzene. And that was only the smoke part. And when we looked at the aerosol part, it has got all sorts of aromatics, primarily benzaldehyde, toluenes, styrenes, and all sorts of those things. The interesting thing is, the water that people think is filtering out a lot of those things, they primarily filter out the aromatics. And it depends how long the smoking session is going on with that specific volume of water. If they're not changing the water after every 2 or 3 sessions, then the water is actually saturated. So what people are smoking, it is not getting much filtered out either. And the other very dangerous trend that is started over the years that I saw was in some of those upstart smoking lounges, they are using milk and fruit juices instead of water for smoking as a filtering thing. The problem is milk and juices do not filter as efficiently as water does. But because of a status symbol or something, we are using those kind of liquids.
I think you ought to make this knowledge a little bit more available. This would be a wonderful thing you could send to the newspapers, a little bit of backup.
We are trying, actually, we are going to publish this focus note paper sometimes
I
next
think
month.
you should really do.
Yes, and we also just got a paper published on vaping in August. In that we show that we know that the flavoring agents, the tobacco, all those things have harmful effects, but it is primarily the amount of glycerol as the base liquid that causes formation of a lot of toxic compounds. And we show different percentages of glycerol, that as you increase the percentage of glycerol from 0 to 100%, the toxic amounts of various compounds keeps going up. And people smoke with more glycerol to have that big cloud effect that they get with smoking.
I think the message should be, seems to be safe, misleading, it's really dangerous, and then you provide the data just as shown to here. I think that's a killer paper. And I would do it.
Well, my baby paper is published in a
But do the waterfront.
ACS journal, in water pipe is coming out.
So if nothing else comes out from today's seminar, if you go ahead and do that.
That's great. Thank you.
Okay, thanks, appreciate it. Hey, thanks for showing up, folks.
Okay.
I want to stop the recording here real quick here.
Okay.
Thanks, hey, Jan.
Okay. How are you?
I'm good, thank you, I apologize.
Oh, that's all right. All right.